Okay. Hello, everybody. I'm back again. This is Sharonda, and this is my podcast, Health Matters. And so, in this particular podcast, I go over things in regards to um, the pathophysiological effects of the body. And so, today's topic, we're going to speak on inflammation, which is something I oftentimes suffer with. And typically, inflammation is one of those sub. It's an indication. It's actually a sign as well as a symptom to something else. So I'm on a website. I'm going to actually read it verbatim, even though um, to give you some information about inflammation. So what is inflammation? Well, inflammation happens in everyone, whether you are aware of it or not. The immune system creates inflammation to protect the body from infection, injury, or disease. There are many things you wouldn't be able to hear from without inflammation. So, in other words, um, I'm gathering that is a part of the immune system or the immune process. Sometimes with autoimmune diseases like certain types of arthritis and IBS, um, your immune system attacks healthy cells. So, inflammation is classified in two main types. You have acute inflammation, which usually occurs for a short duration. It often resolves in 2 weeks or less. Symptoms appear quickly. This type of restores your body to its state before injury or illness. You have chronic inflammation. It's a slower and generally less severe form of inflammation. It typically lasts longer than 6 weeks. It can occur even when there is no injury, and it doesn't always end with when the illness or injury is healed. So chronic inflammation has been linked to autoimmune disorders, even prolonged stress. What are some of the symptoms of inflammation? Where it says heat, pain, redness, swelling, and loss of function. So, long-term inflammation can lead to a number of symptoms and affect your body in many ways. So, some of the common symptoms of chronic inflammation are body pain, constant fatigue, and insomnia, depression, anxiety, and other mood disorders, GI issues or gastrointestinal issues such as constipation, diarrhea, and acid reflux, weight gain, and frequent inflammation or infections. Symptoms of common inflammatory conditions. So it says the symptoms can also vary depending on the condition that has an inflammatory component, such as autoimmune immune conditions. Your immune system affects your skin, leading to rashes. And other types, it attacks specific glands, which affect hormone levels in the body. So you have rheumatoid arthritis, where the immune system attacks your joints. In instances such as this condition, you may experience joint pain, swelling, stiffness, or loss of joint function, fatigue, numbness, and tingling, limited range of motion. In IBS, which is inflammatory bowel disease, inflammation occurs in the digestive tract. Some of your common symptoms are diarrhea, stomach pain, cramping or bloating, weight loss and anemia, bleeding ulcers. So it does mention about multiple sclerosis, MS. Your body attached the myelin sheath. This is the protective covering of the nerve cells. So you may experience numbness and tingling of the arms, leg, or one side of the face, balance problems, double vision, blurry vision, or partial vision loss, fatigue, cognitive problems like brain fog. So the causes of inflammation, where there are many factors that can lead to inflammation, um, chronic and acute conditions, certain medications, exposure to irritants or foreign materials your body can't easily eliminate. Recurrent episodes of acute inflammation can also lead to chronic inflammatory response. There are also certain foods that can cause or worsen inflammation in people with autoimmune disorders, such as sugar, refined carbohydrates, alcohol, processed meats, and trans fats. So, how is inflammation diagnosed? Well, blood tests. There are blood tests that you can have performed to diagnose inflammation. SPE, serum protein electrophoresis, is the best way to confirm chronic inflammation and measures certain proteins in the liquid part of the blood to identify any issues. Too many or too little of these proteins can point to inflammation and markers for other conditions. CRP, C-reactive protein, is a naturally produced protein within the liver in response to inflammation. A high level of this protein in your blood can occur due to several inflammatory conditions. You have ESR, erythrocyte sedimentation rate. So this type of test measures the inflammation by measuring the rate at which red blood cells sink in a tube of blood. The quicker they sink, the more likely you're experiencing inflammation. You have plasma viscosity. This test measures the thickness of blood. Inflammation or infections can thicken plasma within the blood. Other blood tests. So you do have other tests for if there's inflammation due to viruses and bacteria. You have other diagnostic tests, such as MRIs and X-rays. If there's some GI problems, there may be a colonoscopy, sigmoidoscopy, and an upper endoscope. So how can you remedy the problem at home in regards to reducing inflammation? Well, sometimes fighting inflammation can be as simple as changing up your diet by avoiding sugars, trans fats, and processed foods. So here are some anti-inflammatory foods that you can incorporate in your diet: berries and cherries, fatty fish like salmon and mackerel, broccoli, avocados, green tea, mushrooms like portobello and shiitake, spices like turmeric, ginger, and clove, as well as tomatoes. You can also take supplements as well. Use hot or cold therapy for physical injuries to reduce swelling and discomfort. Exercise more often than not. Manage and reduce your stress levels. Quit smoking. Treat and manage any pre-existing conditions. So there's other treatment options for inflammation. You have NSAIDs and aspirin, which are non-steroidal anti-inflammatory drugs, which you can get over the counter, such as aspirin, ibuprofen, as well as naproxen. A prescription varieties include diclofenac, and which is actually a analgesic. Well, I mean, it comes in an ointment analgesic form where you can rub on the body. Corticosteroids is a type of steroid commonly used to treat swelling and inflammation as well as allergic reactions. You can get them in nasal spray or oral tablet form. Topical analgesics and creams as well. They help with inflammation such as arthritis. So in closing, inflammation is a normal and natural part of the body's immune response. Long-term or chronic inflammation can lead to damaging effects. So it seems to be associated more often with autoimmune disorders. Acute inflammation is a normal part of the healing process and may occur when you're experiencing a sore throat or even a small cut on your skin. Acute inflammation should go away within a few days unless it is left untreated. So that's basically the information in regards to this Health Matters episode on inflammation.